Hello, everyone, and welcome to another episode of the Cycle podcast and video. I have Lindsey here with me today. She is from Alberta, and she is an occupational therapist and does a lot of wonderful things for women with endometriosis. And she's really discovered women with endo or just people in general with endo through her practice. So I really want to talk to her more just about what she does and how we can help ourselves. So with that, Lindsey, I'm going to let you take it away and just tell us a little bit about yourself and how you got here. Oh, she also does mental health as well in combined with this, which is amazing.
There you go. Well, thank you for having me, Melissa. It's such a joy to be on the podcast. And yeah, I think you've nailed most of it. So I'm an occupational therapist living in Alberta, Canada. I own and operate a small women's pelvic health clinic. And so really the focus there, our mission is just to help women live every day with confidence and joy through improvement in their pelvic health. And a piece of that, like you mentioned, is it's so tied together is the mental health piece. So trying to use that holistic biopsychosocial approach and make sure that we address everything physically that we can, mentally that we can, and emotionally as well.
Right? Yeah, absolutely. And it's wonderful. And I just want to learn more about how you started seeing patients and putting things together that you were starting to be like, I think this person has endometriosis when maybe they didn't even know it, or what are some of the signs and symptoms? But I guess actually, let's back up. Tell me about, I always want to just jump right into endo, but for people listening, they might not know what a pelvic floor therapist does or pelvic floor therapy. I've never had that done actually personally, but I recently just talked to someone who had pelvic floor dysfunction, which she also had a lot of pain. And when she started going to pelvic therapy, she actually felt a lot better. So I guess let's start with the basics because I don't even have a deep understanding of it.
Absolutely. So pelvic floor therapy is essentially where we are looking at the pelvic floor muscles and the inner core, sometimes called the inner core 4. So it's actually a whole system in our abdominals, our core, our diaphragm, where we really use the systems in the body to manage things such as pressure, leaking, so prolapse, but also in there is things like endometriosis, adenomyosis, vulvodynia, vaginismus. So lots of those chronic pelvic pain conditions, because those muscles in our body, so the inner core 4 being the pelvic floor, so there's 3 layers of muscles there, the transverse abdominis, which is our biggest abdominal muscle, it's also our stabilizer, and then the diaphragm at the top, so our big breathing muscle, and a couple muscles in our back called multifidus. And so we really want to make sure that that whole system, it has optimal function. So it needs to have range of motion, some freedom to move, and really the physical symptoms that we see in pelvic floor dysfunction, which include that leaking, pressure, and prolapse. So where our pelvic abdominal organs like the bladder, the uterus, and the rectum, they might start to shift, and we don't want too much shifting or descending down. That's when people notice maybe that heaviness. And then pain is another one of those physical symptoms that something in this system is not working correctly. And I would really encourage, anyone who is living with endometriosis or any type of pelvic pain to make sure that pelvic therapy is part of their maybe treatment process. It is more helpful for some people than others. Obviously, we know for endo specifically that, excision is kind of that gold standard, but what else can we be doing that's more conservative and to manage things once we start to get on track, right? So as a pelvic floor therapist, some people do internal work. So we would actually take our fingers, gloved, obviously, all the precautions, everything, not just in COVID time, but all the time. And we would actually palpate inside or feel inside the vagina for different things. What are the muscles doing? What are you feeling? Because we can't feel what you're feeling. Is there any tendons that are not working well, any ligaments that are kind of not in their optimal function, and then nerves as well, right? So we would do that vaginally, we would do that rectally, because there's a whole lot of muscles in the back end, and we know what happens in the back end impacts the front. And then as well, there's lots of us who work externally as well. So I use internal in my work, but if you aren't able to or aren't trained to, there's still a lot that we can be doing from an external perspective, whether that's range of motion and, making sure that those muscles are working appropriately in the whole body. It's a system, right? So often some of the questions we'll ask people is, do you have tension headaches? How are your feet? Is there plantar fasciitis? Because we are one being right from the top to the bottom. So we want to put those things together, connect all the dots. And then as well, we want to know what else is going on in your life. And this is the more holistic piece. So some physios will go this way, more so occupational therapy in my experience. So both physios and OTs can be pelvic floor therapists. And really, we want to ask about, what does your day-to-day life look like? What about trauma, grief, loss? Those things can be very triggering. What about your history? Has there been any abuse? And then what about right now during a time of kind of chaos, we're recording this during COVID, is stress, finances, relationships. All of those bits and pieces have their say in the pelvic floor. And traditionally with women, even more so than men, we hold our emotions in that pelvis, right? In the pelvic floor. So we talk a lot about whether someone has a weak pelvic floor or whether they have an overengaged pelvic floor. And I'm a classic example of an overengaged. So it's like walking around with your bicep half cocked all day.
Right.
Everything's tight, everything's holding. And we typically see this in people with chronic pelvic pain as well, because we have so much tension, we're feeling discomfort, and we fold in.
Mm-hmm.
So I hope that made sense.
That's a wonderful explanation. And how would we know, like, do you feel like anyone who's diagnosed with endo should go see someone or talk to someone regardless if they think they need to or not? Because like I said, I've never gone to a pelvic floor therapist, and I've been suffering for so many years. I guess it's just not something I've thought of, but it has. I know other endo patients who do go. So is it just something that people should explore initially to see if they're tight or this could be causing some pain and problems?
Absolutely. I think we should encourage that, just the same as you might encourage many of the other things. I think someone who's living with a chronic pain as well should always be seeing someone for mental health, or at least have access, right? You may not need them all the time, but to try and have that in place. Different things like that, having a really great care team in place. A pelvic floor therapist is just another person. And so the reason I say that is because things like endometriosis are so layered, right? Yeah. And so if we can make a 1 or 2 or 3% improvement, it doesn't seem like much, but maybe if we make that 1, 2, 3% improvement, maybe that's the key, the next gate that we need to unlock before we can make the next 2, 3% improvement. And we slowly gain traction. The other thing is that just as someone without endo, and I always make sure people know I do not live with endo, right? But there's a lot of other things that impact our life. So, have we been an athlete? Athletes typically have a little bit more pelvic floor dysfunction. And, what about, have we been pregnant? Have we had children? Yes or no? Have we been through fertility treatments? Yes or no? What are all those other things that are coming into play for anyone?
Right. Very
so
interesting.
We can be making improvement. Yeah.
Yeah. And I think that that's such a valid point. And I mean, even especially now, or people who can't access excision care or the proper surgery, this could be a step at least to getting, it's not going to cure the disease, but it's a relief that can help release some of the stress and the tension in that area. I feel like I just have so many questions that I want to ask you, but for nerve pain and how that works with the muscles, I know a lot of endo patients experience nerve pain, and myself personally. Is that something that you can help with as well?
Absolutely, right? So is it going to be 100% for everyone? No, I don't think there is anything that's 100% for anyone.
Right.
But we do have some major nerves running down through that pelvis, right? A couple of the more popular nerves would be sciatic nerve or the pudendal nerve. And so when our muscles are not functioning properly, and I say muscles, we're also going to talk about connective tissue, so the fascia, right? So the white sheath over the muscles, all of those different things that come together, the joints, so important as well. And so when those muscles, though, particularly are running around the nerves, and so I know we have a visual here. If this is my nerve, here's the finger, and you can imagine for the people listening, holding up your pointer finger and then taking your other hand and clenching it around it in a fist. So sometimes we can actually squeeze and impinge a nerve like this, right? Or it can get compressed between multiple structures. And so we need to be able to either relax that muscle off, get that nerve gliding again, or we need to have movement in that whole system and the whole structure so that that nerve has the ability to do its job without irritation, right?
Makes a lot of sense. Yeah, it makes a lot of sense. So that brings me to my next question. You know, many people with endo have had multiple surgeries, and sometimes in those surgeries, you know, the surgeons may not understand where the nerves are, or there may be, you know, endo near a nerve or on a nerve. And I don't want to go crazy down the nerve path, but just in general, like after having multiple surgeries, I would have to assume that that area is going to be fight or flight, right? Like it's been through some trauma. And so do you see people after surgery as well to help kind of get the balance restored?
Yeah. So I look at any of the surgeries, whether it be an endo surgery, whether it be a hysterectomy, whether it be even just the laparoscopic, you know, to be looking at diagnosis. We want to see people pre and post. It's no different than a knee replacement, a hip replacement, you know, an ACL reconstruction in the knee. We just want to make sure that people have the best function going in, because then we know that they are going to have a better recovery coming out. So coming out, we do want to see people again, especially for an excision surgery or anything like that. We do have some scarring happening too. We've gone through that abdominal wall. So it's very similar to a C-section. So one of the things that can be happening as well as where we have those small scars is we can actually be building up scar tissue, which scar tissue is great tissue, very functional. But if it starts to clump together and it starts to adhere backwards through the layers, almost sticks like Velcro. So again, we'd have something that's stopping the actual glide of the whole system. That inner core 4 can't work the way that it wants to.
Right.
We've also poked a hole in the system. So we have a point of potential weakness, right? So scar tissue is actually going to make that stronger. But in that recovery stage, we want to be mindful. How are we using things? One quick thing is, you know, do you hold your breath? So because the diaphragm and the pelvic floor are actually tied together top and bottom, okay, by that abdominal system, when I breathe in, my pelvic floor should drop, open, and relax. And when I breathe out, it should contract or quote unquote kegel, right? And so if I'm holding my breath and I breathe in, the diaphragm's coming down and that pelvic floor doesn't move, or that abdominal wall doesn't expand. So think about your tummy kind of coming out. And most of us women go suck in and hold, right? So we've just stopped some of the gears in the system. And now nothing can move. And the pressure in a closed system, like a soup can, has to come out somewhere. If the system's not moving, pressure comes out as leaking, as prolapse, as pain, or as hernias or issues with excisions, or any of the kind of the defects in the wall. So a C-section a surgical cut, anything like that. And like you said, the autonomic nervous system, the nervous system is up in fight or flight. We need to learn how to bring that back down.
Yes.
Right? Give it some psychological safety before we jump into the physical piece.
Right. And so that brings me, for the diaphragm and people who may or may not have thoracic endometriosis, but the people who, I suffer and just recently learned that this is potentially diaphragmatic, but, not just for me, but for anyone listening, neck pain, shoulder pain, behind my shoulder blade, and then almost like my front of my rib during certain times of the month, ovulation or my period. And can you help kind of reduce that as well? And then my follow-up question to that is, I have heard people who've even had thoracic surgery for endometriosis should definitely be coming to see you, because this area is still going to need to learn to release.
Right. Yeah. So I think that we want to make sure that we're not selling people sunshine and rainbows and saying we can make it all better, right?
Yeah.
But definitely, can we be working on all of the parts of the body? Yes. They are all just muscles. They're all just bones. They're all just ligaments. And then it's just endometrial tissue. And I don't want to say just right in there, but really it's the same tissue wherever that endometriosis tissue is.
Right.
So we might work with a pelvic floor therapist. In that case too, I know for myself, and I'll tell the story in a second of how I discovered thoracic endometriosis was even a thing.
Yes.
Is to make sure we have good referrals too. So, hey, I might be thinking, I know somebody, maybe a physio who's really great, or an OT top to bottom, and is really knowledgeable about that shoulder, and that's their specialty. And then we're going to work together, pelvic health and that shoulder girdle, and make sure that we're doing everything to optimize that together. Because if we just have one person, we might be missing something.
Makes sense.
Creating that big team, right?
Holistic. You have to treat it holistically. And sometimes I think people don't think about endo. They think of it as just a pelvic situation, and they don't think it is a full systematic inflammation really is the issue. But then I agree with you. I think that you're a piece of the puzzle, right? Like I do acupuncture too. I think there's pieces of the puzzle to treat endo holistically. But I do want to hear your story about kind of how you got really into like knowing about endo, and, really even just wanting to come and talk on the podcast, because I think it's very interesting what you're doing in Alberta, and hopefully, more digitally throughout Canada for now. But I think it's great how you kind of recognized it. So I'd love to hear that.
Thank you. So I'm going to back up just a little bit. So as an occupational therapist, I always thought I would work in a rural general hospital, which I did to start. Dream job. It was great. We took a little bit of a turn into left field when I ended up taking a position in acute mental health. So in our town, we have one of the major psychiatric facilities in our province. And so I went and worked there, and my job was to help people who had become stable. So they'd been in hospital, or maybe they were in community struggling, but they were stable enough with their mental health that we could really get to work on things like their mindset, their life skills, everything like that. And one of the biggest things that we talked about was hope. So we have Hope Group at 1:00 every Friday, because we expected our clients to go home, and we expected them to try and live their life as best they could. Then they'd come back on the Monday or Tuesday, and we'd go over what went well, what didn't go well. So many skills I learned out of that. And one of the biggest things was to listen. There is pieces to the puzzle that have not been put together. And so that brought me into pelvic health. So I left mental health to start my own private practice in pelvic health, loving it, but really took those skills from the mental health to listen. And one client in particular that I had was, I was just learning about endometriosis. Some clients had come in and mentioned it. I had done my research. We'd been to the courses, but it wasn't playing a big part, or probably a big enough part in my practice at that point. And this girl comes in and she's talking to me about all of her pelvic pain, and she can't even walk the stairs because she's so short of breath at the same time. And her doctor had told her that she had pleurisy, which is a lung condition. And, that's all great. But she said, like, nothing is working, nothing. And it just twigged in my mind. And I have no idea where it came from. I must have read somewhere or listened to someone. And I said, I'm going to do something really unprofessional. I'm going to Google in front of you. And she said, okay. Because I said, like, really, we're at wit's end here. I don't know what to do. You don't know what to do. Let's just try.
Well, and you kind of knew, your intuition, like, kind of remembered, like, something sounds off. Yeah.
So let's plug in endometriosis and pleurisy. And pops this research paper on thoracic endometriosis.
Oh, wow.
I read the case study to her, and she said, you just described every symptom I have, except on the other side. So typically thoracic endometriosis is one-sided and there's a dominant side. And she was experiencing on the other side, but she'd also had a diaphragmatic tear during pregnancy. So there was an opening in her diaphragm that healed, obviously, but there had been a way for that endometriosis to move.
Oh my goodness. Wow.
So it took us about 3.5 months and a doctor switch for anyone to even think we should start to believe this. And that was a lot of advocacy on her part, a lot of advocacy on my part. And that's where I really started to notice these people, especially in our area, we don't have the resources. And the people that are here that are so great about things like endo are overtaxed, like they're full.
Yeah.
So we need to start at the grassroots level and get everyone aware so that they can start to make better referrals and start to do better investigation, because so many girls are just being told, go on birth control and it'll be fine.
Yeah. Or it's normal. Like, your pain's normal. It's not a big deal. Yeah.
Not a big deal.
You're passing out every month. You're fine. Everybody does that.
Rolling on the floor. Yeah.
Yeah. It's totally acceptable. Yeah. That's so incredible that you changed her life. Mm-hmm. Was she able to get the treatment that she needed?
Not as of yet.
She's still waiting.
Still ongoing. And I think there's more to that, right? Is the access to resources. And then as you would know, and many of your listeners would know, the energy that it takes to push and push and push in a medical system. Sometimes you just get tired of it. And there's other things in your life that honestly might seem more of a priority.
Yeah.
This person owns a business. She has 2 kids, trying to do all these things. And where does it fall? And
it shouldn't be like that. And I recently just spoke to someone else on the podcast, similar situation. She was like, I was busy and I just had to stop dealing with it because it's so constant and seeing so many doctors and therapists and scans and this and that. It's constant. But what she did say is that she regretted it a little bit because she then ended up having a bowel obstruction. So for people who are listening, bowel, lung, I know it's tough, but keep pushing and trying to push forward because, it's tough. And that kind of segues me into, you have a lot of mental health training, and this is obviously, endo is stressful normally, but then on top of it, we have COVID right now, and people with endo, they can't get the surgeries that they may have had elected. They can't get an ultrasound. They can't get a scan. They can't see their doctor in person. They have to do telemedicine. So from a mental health, and even I want to get into a physical side too, what are some things that we can be doing right now to ease the mental and maybe some of the physical pain? It's a big question. I just put you on the spot, but I know you can answer it.
It's a massive question, but you know what? And the answers sound simpler than they are to do, right? So I want to preface that. Stress management is our number one tool right now, regardless of any chronic pain condition that we're living with, or any condition, really. Mental health, physical health, otherwise, or a combination, right? And so noticing for yourself. I love body scans. So just noticing, even setting a timer on your phone, or I use sticky notes up on my wall. Blue means breathe. Purple means, body scan. I'm just going to notice in my body, head to toe, where am I carrying tension? Am I breathing? Am I not? We hold our breath far more than we think we do. And breathing is one of our number one strategies to actually regulate the nervous system. The other thing is I don't know about you guys, but I'm home with my 2 and my 4-year-old. So that's a whole new ball game.
Right.
I was not the best on maternity leave to start with. And now we're coming back to it with extra stress. And so whatever we do to regulate, we're also co-regulating with other people. And we co-regulate up to into our mid-30s, right? Until we learn to self-regulate. It's not actually technically self-regulation till our mid-30s. And during times of stress, it's less. So we probably aren't self-regulating very well. So using breathing is one of my favorite things to do for mental health and physical health. Some of the other things that we want to do is access those tele-rehab resources. So pelvic health therapists are going online. And the big piece that I want to say is a bonus to this is so many therapists, so many modalities, so massage and acupuncture and all of these things, which are amazing, are very hands-on. Yeah. So we end up doing to the person. And that's what we call passive therapy, right? But what we've had to do during this time, moving into telehealth and different things, is pass the ball back to the client, back to you. And what that does is empowers you. Mm-hmm. Okay, here's some things that you can do anytime on your own that are going to make a difference versus having to come to me every week. For me, if somebody has to come back to me every week, I'm not doing my job. We need to start to kind of space that out and use that as a way when I'm having a flare, different things, then we're going to do that. Now, something like massage, heck yeah, go all the time, right? Like, fantastic, if you can. But lots of people, A, can't afford to, and B, we don't have access. Mm-hmm. So the other thing that I would love for people to do is take advantage of all the free resources out there. So we don't want to overwhelm ourselves, but maybe it's time when we can look outside of those, I'm going to call them traditional areas. So our physical pieces and our therapies, those sorts of ideas, our doctors, and can we turn to other things? So right now I'm in the middle of recording what we're calling the Healthy, Happy, and Able speaker series. And it goes live April 28th to May 1st. But what we have in there is a bunch of people who you would not expect to be connected to pelvic health, talking about how their area of expertise impacts someone living with pelvic pain, or in this case, endometriosis. So yes, nutrition is a pretty big endo one. That's usually already in there. But also we have someone who's speaking about relationships, how to improve your relationships. How is that going to impact your pelvic health? Well, I don't know about you, but lots of my clients with endometriosis have a ton of issue with painful sex, right? It's a big, big thing. And one thing that is a pet peeve of mine is when they're given dilators. So almost like medical dildos, really, right? And I don't believe we should do that until we have psychological safety. So what about setting up your environment? So if people have had bad experiences, like my personal background is painful sex. And so the bedroom is not the best place for me. It has an environment full of memories of painful sex.
Right.
So how can we actually adjust and tweak our environment to meet our brain's needs and create safety? What about communication with our partner?
Big one.
Women in general, and men do the same. We make up stories in our mind about what the other person is thinking. And they probably have not a clue, and they're not mind readers. So how do we communicate, and how do they start to own a piece of this as well in that care team, but also as your partner? How can they hold that space? There's someone coming to talk about personal finances during this time. What are your options? How can we maintain stress levels around finances? And what about hope? So there's actually a whole science of hope. It's
Yeah.
a subset of positive psychology. And so someone just talking in this series about hope and how can we build that? How can you keep that going when we have so many crazy things going on and you're in the middle of a pain flare? That's not really typically a hopeful time.
Right.
Right?
That sounds wonderful and much needed for sure. You'll have to give us the information on all of that. So if people want to attend, I mean, it sounds exactly what people need right now, and especially women with endo coping with this at this time. And I love what you said about breathing. I think I never understood that I was never breathing properly. Like I was just like, and until I started to like realize, until I started going to yoga and realizing it, and they were like saying like, breathe through your belly. I'm like, what are they talking about? Like, I don't know how to breathe like that. But until I actually learned how to do it, I always tell people, take 10, just stop right now and take 10 deep breaths. And you literally can feel everything in your body start to relax. Now, when you're in acute pain, is that what you want to do? No, you don't want to do anything, but it actually really does help. It calms your mind, calms your nerves, it calms your body. And so that's something that I try to practice at least twice a day, at least. And I've added meditation. And I know a lot of people are like, oh, everybody says do meditation, yoga for endo. And I get it, but it has helped me separate my brain from my body. Like you said, with the body scan, like start at the top of my head and scan down and isolate where is the pain exactly. And what can I do to help make that feel better? So, and then Epsom salt baths, if for anyone who's listening, that's something I love to do. And they really do help. I mean, they will help kind of relax everything if you have access to bathtub and Epsom salt. Is something that, that I've been practicing while in quarantine. Every Sunday I try to make sure I do one. And if I have another day where I don't feel well, I'll do one of those as well. So, but I think the mental health component is such a big piece too. And talking to someone and communicating with your partner is huge when you have endo. And it's very hard, at least from my perspective. Right. And I don't know if this is, a woman thing or what, but like, sometimes I have a hard time admitting like that vulnerability that I don't feel well, or that I can't do this. I want to be able to do everything. And sometimes you can't, and it's okay to admit that, so that's huge. Okay. Well, good. Well, what else? Is there anything else you want to share with us or tell us, or is there anything like we can be doing to ourselves, like giving ourselves self-massage? I don't know.
Absolutely. You know what? If you're a lady with a C-section, for sure. If you're someone who's had laparoscopic or excision surgery, absolutely. Anywhere that we've had surgery. So there's some wonderful scar massage resources out there, so I can send that over to you.
Sure.
And absolutely, that's something. The other thing, it sounds really funny, but it's to take care of your bowels, right? The bowels are the key.
So funny. I was literally like, I need to ask her about bowels, because I had a bowel resection. But I do feel like when you get constipated or you're in the house and you're not moving as much, the pain is worse when I'm constipated. So what tips can you give us to help us with the bowels?
Okay. 3 easy tips for the bowels. I'm going to go 4 actually. Okay. Is we need to be getting enough hydration, more water. I'm the worst at it too. Everybody, we can try for some more water. One of my favorite things is to use one of the water bottles that has the hours on it, right? Yes. And the reason why too is because if you gulp water versus sip water, when you gulp, you output 6 times as much. So you're actually not hydrating yourself. So if you slam a glass of water in the morning, or you slam a glass of water just before bed, because you're trying to make your goal, right, we're not doing ourselves a favor, right? So if we can spread that through the day, we're going to be more hydrated. We're also going to be more consistent, which bowels are all about consistency, right?
Yeah.
The other thing, I'm not a nutritionist, I'm not going to go that side, but using a squatty potty. So I don't know if you guys have those. Yes, yeah. I'm mad. American thing, right? So you're having a stool under your feet. So you need to get your knees higher than your hips.
Okay.
Okay. And what that does is in the actual pelvic floor itself. sorry, just grab my pelvis.
Oh,
Okay.
handy dandy pelvis.
So in our actual pelvic floor itself, the bottom layer of that pelvic floor, so there's a muscle inside called puborectalis. And so when we get our knees higher than our hips, it actually slacks that muscle off. So if this is my rectum, and I'll describe this for people who are just listening, if our rectum is sitting there, if we are sitting with our knees lower than our hips, the poop has to take a roller coaster ride. It has to go up and down and around gravity. That's a lot of work and a lot of energy, which especially when we're in a flare, we don't have a whole lot of that. So if we can slack off a muscle just by raising our knees higher than our hips, we create what is quote unquote a poop chute. So it's just a straighter path for that bowel movement to go.
It's great.
It makes a huge, huge, huge difference.
Yeah, that is an amazing tip.
Yeah. And then the last one is just some movement piece. So I always say if you typically do go to the washroom in the morning, so for example, if you're regular in the morning or you'd like to be, do 10 or 15 squats. Okay. I don't care what your form is, just do 10 to 15 squats. Get things going about 10 minutes, 15 minutes before you want that bowel movement to happen, and have a hot beverage. So I know caffeine can sometimes be a trigger for people, but even hot water, just something warm to get that system going. And then a quick bowel massage. So, or an I love you massage. And I'll send along the link for that as well. Okay. And really it's just helping, it's an abdominal massage, and we just help things move along the system. So we're typically going to come up, over, and then down. And I can send you the handout for the show notes there, but
okay,
those things are going to make a difference. Might not be 50% different, but it's going to make a difference for everyone. And not just for the people in your house with endometriosis.
Right. For everybody. And everybody's just moving. We are moving less. I mean,
so much less
because we're just at home. So yeah. I think those are wonderful tips. And I definitely struggle with that. I take magnesium citrate every night. I take 2 before bed, and that really helps. But when I'm in a flare for some reason, and it must be because my muscles are tight, I always get constipated. As soon as my flare up happens, like I cannot go. And I'm sure it's because everything is just angry. But I'm getting a squatty potty. That's such great information.
Oh yeah. If I could buy shares right now, everybody else is buying Zoom, I'd be buying squatty potty.
That's it, because everybody needs them right now. Yeah.
Right.
That's wonderful, wonderful tips. Thank you so much for coming on, and plug all your information. Tell us about you. I mean, can you see people via telemedicine only in Canada, or what, like, if people want to reach out to you or find you? I also started a Facebook group for people who have been on the show, in case there's, just for the show, it'll be pretty private, but like if people have follow-up questions or anything like that. But yeah, plug all your good stuff so we can find you, and tell us how we can find you. Absolutely. So our website is e-motiontherapy.com. So emotion, you can imagine the physical and the emotional, mental side. And then Facebook and Instagram, we're just at emotion therapy, no hyphen in there. And then the big thing is that as a hands-on therapist or someone doing tele-rehab, we're usually confined by our state or our province. Some people might be regulated in more than one province or state. I can only see people via telehealth and in person in Alberta. But so what we've done is taken all this information and put it into an online education kind of program. So everything might not line up exactly for you, but it's all there. So you can pick and choose what you like from it. And so I call that Living Well with Pelvic Pain. And we're actually going to be, the launch for that comes at the end of May. So definitely if you guys are looking for some resources, doing that sort of thing, we're going to have that Healthy, Happy, and Able speaker series first, April 28th to May 1st. If you missed that, don't worry, it's all good. We'll make sure people have access to all that information. Then going forward, we're going to be chatting about that, and it will be all over our social media to sign up for that Living Well with Pelvic Pain course that's open to anyone in the world. And really that was built
with endometriosis and adenomyosis in mind. And then we expanded that out to include other people.
Oh, that's so wonderful. Thank you for all you're doing, honestly, for
Thank
women
you.
with pelvic pain and recognizing it and just, you know, being an advocate too for patients, because, you know, it's hard to find, but you've seen the pain, and I'm sure you understand it, pain in real life. I actually, just speaking of pain, follow-up question for people who are scared to go to pelvic therapy for the first time, you know, if, you know, painful sex, like you said, but you know, the thought of someone like touching us in that spot or something like that could be very scary. Is there, I mean, obviously a therapist, you know, if they come to see you or someone else, is going to start off slowly. There shouldn't be pain associated with that type of appointment, right?
No. And if there is, then we need to verbalize it so that therapist can back off. But what I always tell people to do, phone 2 or 3 places if you have access to a couple. You know, really make sure you have a good fit.
Yeah.
Because it's no different than your doctor. You want to have a great relationship with that person. You're bearing all of your vulnerability.
Yeah.
So it should be at your pace. It should not be painful. And they should also be able to say right back to you, you know what, I think that I'm not meeting all your needs if they're not. And they have a full team of people behind them as well that they're going to refer you out to if they're not the right person. And that's when you know you have a good therapist, is that you can either make that click and that connection, and or they have the people to resource you if they aren't that person. So don't feel like you have to go to one person and stay. You can always, in my opinion, people phone, I spend 10-15 minutes on the phone with them before they ever book an appointment, because they need to know A, what they're coming into, and B, is this the right match for them? And we're going to explain that right from the get-go. If you don't want to do an internal assessment, 100%, we don't need to do that, right? This is your choice. You're in the driver's seat. And at any time, if you change your mind, we just back off and we go a different route. And that's all good, right?
Yes, thank you. And, you know, that was something I really want to make sure I asked, because I'm sure people are very nervous going for the first time. Yeah, first off, it's extremely personal, but on top of it, if you're already in pain in the area, you're like, I don't want someone touching me there, you know, like I'm already in pain. So,
yeah. Okay. And so we might not even work on that the first time.
Right.
We might just get into mindset. What's our mindset around pain? How can we change that first?
Yeah.
Right.
Love that. All right.
And this is where this podcast is amazing. So I want to say thank you from all of my clients to you, because these are the supports they need, right?
Yes. Well, thank you for taking your time and sharing your practice with us and kind of everything that you've learned. I think it'll be very helpful for everyone listening. So I hope you have a wonderful day.
You too. Chat soon.
Take care.